Good evening, students. Today we are going to discuss very important MCQs on CNS, NSETS, GA, and LA. These all topics are very important regarding NEET 2026. The important content of these topics are for NSETS, the important contents are drugs of insects in which the mechanism of action of these drugs, then the classification which leads to the non-selective COX inhibitor. In this non-selective, aspirin, ibuprofen, and diclofenac, they are very important. In selective COX-2 inhibitor, the important drugs are celecoxib, and their uses, analgesic uses, antipyretic, anti-inflammatory uses, and the management of rheumatoid arthritis, osteoarthritis, and the gout. The drugs for these diseases, they are very important. In the CNS, the important one are opioids. In the opioids, the most important drugs are morphine, fentanyl, and tramadol. Now, the mechanism of action of these drugs, how they are going to work, by which receptor, opioid receptor, these are very important. And the adverse effects of opioids are also very important. In the anti-epileptics, the important topics, important drugs are phenytoin, valproate, carbamazepine, anxiolytic drugs, in which in the anxiolytics there is sedatives and hypnotics. In the sedatives and hypnotics, the benzodiazepines are very important. Benzodiazepines, in the benzodiazepine, lorazepam, diazepam, they are important one. And in the antidepressants, the SSRI group, selective serotonin reuptake inhibitor drugs, they are very important. And in this selective serotonin reuptake inhibitor, the important class of the drug is fluoxetine and sertraline. These are very important. In the LA, the mechanism of action of the LA, then the classifications, esters and amide. In the esters, cocaine and procaine, and in the amides, there is lidocaine, bupivacaine, they are important. Then local infiltration, their uses, local infiltration, epidural, spinal anesthesia, and their toxicity regarding these are important one. And last, in the general anesthesia, the most important drugs are halothane, which is a hepatotoxic drug. It is potent, but it is hepatotoxic. Isoflurane, which is less hepatotoxic. Sevoflurane, which has rapid onset and recovery. These three drugs are important in the category of inhalation agents. And in case of intravenous, the important is propofol, ketamine, etomidate are important, and the adjuvant drugs which are used for the general anesthesia, in that benzodiazepine, midazolam are important, and the opioids, fentanyl are important. So we are going to cover these topics with our MCQs. We are trying to correlate all the MCQ with the concept so that the related MCQs, if come in your exam, you are able to answer them. So we'll see all the concepts by the MCQ one by one. So starting with the first question, which is which of the following drug is least efficacious in the treatment of temporal lobe epilepsy? First, what is temporal lobe epilepsy? Now the epilepsy is divided. What is epilepsy? First, the question is, what is epilepsy? Epilepsy is a group of CNS disorder in which there is cerebral dysrhythmia. What is epilepsy? There is cerebral dysrhythmia. The rhythm of the cerebral cortex, it is disturbed in case of epilepsy. So what happens in that? In the epilepsy, there is continuous or intermediate electrical discharge, electrical firing is seen. Electrical firing in the neurons, electrical firing. Now, this electrical firing in the neurons, they are called seizures. Now, according to the seizures, which type of the seizure is arising in the person, we have divided the epilepsy in the various types. First is the generalized epilepsy. Second is the localized epilepsy. So, in the generalized, we have various types. First is the grand mal epilepsy. According to the type of seizure, we have to give our anti-epileptic drugs. Grand mal epilepsy, petit mal epilepsy, or there is infantile spasm. There is myoclonic seizures. This grand mal is the epilepsy, and the seizure which arise in this is the generalized tonic-clonic seizures. The petit mal is the epilepsy, and the seizure which is arise in this is the absence seizure. Then infantile spasm, it is a type of seizure which arises. Then there is myoclonic seizure. These are the types of seizure. Then there is localized. Localized means when it is involving the localized area in the cerebral cortex. If it is involving a single area in the cerebral cortex, a single lobe in the cerebral cortex, then it is called simple partial seizure. The seizure which are arrived by this is called simple partial seizures. If it is going to involve temporal lobe, if it is going to involve the temporal lobe, then it is called complex partial seizure or the temporal lobe partial seizure. Now, the treatment of this drug, treatment of this condition can be phenobarbital, can be phenytoin, can be carbamazepine. But the primidone, it is the least efficacious in the treatment of temporal lobe epilepsy. So the temporal lobe epilepsy is also called complex partial seizure. If the question arises like this also, which of the drug is least efficacious for the complex partial seizure? It is the primidone. Second question. All are true of diazepine, except what is diazepines? These are benzodiazepines. What is benzodiazepines? These are the class of the drug which is used in the several CNS conditions. Several CNS conditions like this diazepines are used in sedatives or hypnotics. This diazepam is used as an anxiolytic drugs. This diazepam is used as anti-epileptic drug. This diazepam can be used in case of uh, uh, skeletal muscle relaxant, centrally acting skeletal muscle relaxant. And the most important, not the most important, one of the very important use of this diazepam is that it is used in the status epilepticus as well. So there are multiple use of this benzodiazepine. So the question is, all are true of benzodiazepines except benzodiazepine is used in the treatment of status epilepticus. Yes, it is used. Benzodiazepine is used in long-term psychic disorder. It is used in psychic disorder, but it is not used in long term. It is used in short term. If a person is having problem of insomnia, then we can use this drug as a short term treatment. For the long term treatment, we have other drugs. We are using that drugs. For the depression also, we are using that drugs. But for the short term treatment, we can use this benzodiazepines, especially lorazepam, clonazepam, alprazolam, which is used for this purpose. Clonazepam is used for petit mal epilepsy. Petit mal epilepsy, we have seen the epilepsy are of various types. Grand mal epilepsy, petit mal epilepsy. Petit mal epilepsy is also known as the absence seizure epilepsy. Absence seizure epilepsy, it is mainly seen in the children. In the children, they used to stare at one position. So it is seen in the children. In that condition also, we can use the clonazepam, but the drug of choice in this case is ethosuximide. ethosuximide is a drug of choice when we want to see for the absence season. Now, the question is status epilepticus. We have seen status epilepticus. What is this status epilepticus? Status epilepticus is a condition of the epilepsy when the person is having the attack of seizure within the less than 30 minutes, two or more attacks are precipitated. Wherever the word status arises, status means continuously arisation. If it is status systematicus, it also means when there is a continuation of the attacks within the 30 minutes, there are more than two attacks. In the epilepticus, same. If the person is having continuous two attack within the 30 minutes, then it is status epilepticus condition. It is an emergency condition. Normal treatment will not help in this. So in this emergency condition, the first and the foremost drug which is given to solve this condition is our lorazepam. Lorazepam is given in the dose of 2 milligram per minute. Total 4 milligram drug is given. If lorazepam is not present, not available, then we are going to give this diazepam. Again, 2 mg per minute. Total 10 mg dose is given. After that, after this, we will give the anti-epilepticus fosphenytoin, 100 to 150 milligram. If fosphenytoin is not present, then we are going to give phenytoin. Then after phenytoin, phenobarbital. The drugs are given. But the main drug, the foremost drug which is given for this condition is lorazepam, which is a benzodiazepines. So the answer is it is not used for the long term. It is used for the short term treatment of psychic disorders. Next question is morphine is contraindicated in all of the following except. What is morphine? Morphine is a opioid. Now this opioid, it is given in all of the conditions, but it is contraindicated in what? First, we have to see the effects of the opioid. Opioid, the main effect of the opioid is seen that it is going to create respiratory failure in the person with the overdose. So wherever this respiration is affected, we cannot use this opioid as a treatment. Like in case of emphysema, what is emphysema? There is the destruction of the alveoli in the lungs. So because of the destruction of the alveoli, respiratory center is already hampered. So we cannot give this drug. Second, bronchial asthma. In the bronchial asthma also there is bronchospasm. There is already spasm. We cannot give those drugs which leads to this bronchospasm and respiratory failure. So we cannot give this drug. Opioid is a drug which increases intracranial carbon dioxide. It is going to increase. So in the head injury, we cannot use this drugs because it is going to raise the intracranial pressure by increasing the intracranial carbon dioxide. So we cannot use this drug. The only thing which is left is the pulmonary edema. In case of the pulmonary edema, we can use this drug. Next is aspirin produces all of the following except. What is aspirin? Aspirin is a non-steroidal anti-inflammatory drug. This non-steroidal anti-inflammatory drugs, how they work, this non-steroidal anti-inflammatory drugs, because our body is made up of phospholipid, whenever there is any kind of injury, then our body will secrete phospholipase A. This phospholipase A, it is going to form arachidonic acid. Arachidonic acid is the 20 carbon compound. Now this arachidonic acid, when at this arachidonic acid, cyclooxygenase and lipooxygenase, two types of enzymes are there. When this arachidonic acid will work on cyclooxygenase enzyme, then it is going to increase prostaglandin secretion. Now this prostaglandin is further PGG2, D2, E2, F2 टाइप का होता है. And this PG prostaglandin, it can be prostacyclin, PGI2 also, when it is given by the isomerase enzyme is stimulated. And this prostaglandin, it can work through one of the thromboxane synthase enzyme, and it leads to the formation of TXA2, thromboxane synthase, which is thromboxane synthase, as the name is suggesting, it is responsible for the synthesis of thromboxane. Thromboxane is responsible for the aggregation of the platelet, and it is responsible for clotting. These platelets are responsible for clotting. So what is the question that aspirin, what is aspirin? Aspirin is the inhibitor of this prostaglandin. When this prostaglandin is not formed, then this thromboxane synthase is not formed. When the thromboxane synthase is not formed, then clotting will not occur. If the clotting will not occur, it means the bleeding will occur. Bleeding time is going to be increased. So what will be the effect of the aspirin? It is going to increase the bleeding time. So gastric bleeding will be increased. Prolong the prothrombin time. Prothrombin is responsible for the clotting. So the prothrombin time is prolonged. Platelet dysfunction, yes, because platelet function is the function of the platelets are aggregation. So it will dysfunction their action. And last is constipation. No, constipations are not related to the aspirin. So the answer is constipation. Next is a paralyzing dose of succinylcholine. First, what is succinylcholine? Succinylcholine is a skeletal muscle relaxant. What is skeletal muscle relaxants? These are the drugs which are going to relax the skeletal muscles. Skeletal muscles are of the skeletal muscle relaxants. They are very important in cases of the surgery when the surgeries are performed under endotracheal intubation. We want to relax the vocal cord and other skeletal muscles so that the easily intubation can occur and patient can have the artificial respiration through the ventilators or through the ambu bag the patient can take. For that, we need the skeletal muscle relaxants. Now, the skeletal muscle relaxants are of two types. First is centrally acting skeletal muscle relaxant. Second is the peripherally. As the name is suggesting, centrally acting means it is going to operate through the CNS, cerebrospinal axis. Through it is going to act. Then at the peripherally acting skeletal muscle relaxants. Peripherally acting means it is not going to involve the cerebrospinal axis. Now, this peripherally acting skeletal muscle relaxant is are of two types. First is direct and second is indirect. Direct means it is directly going to act peripherally. The example is dentroline, which is not used nowadays. It is just used in case of malignant hyperthermia. It is the drug of choice for malignant hyperthermia. So the most important thing about dentroline, which is a directly acting peripherally acting skeletal muscle relaxant, which is used for the malignant hyperthermia. Now the indirectly acting skeletal muscle relaxants, it can be of two types. First is the competitive and second is the non-competitive. Competitive means when they are going to have the competition for depolarization. It is non-depolarizing. It is non-depolarizing. It is non-depolarizing. Second, non-competitive, which is depolarizing. As we know, for any interaction reaction, we need depolarization. We need calcium, we need sodium for the depolarization. And this competitive or non-depolarizing uh, uh, non-depolarizing type of drug, it will not do depolarization. So the drugs which are used for this is D-tubocurarine and competitive depolarizing, which are going to depolarize the area. The drugs are succinylcholine, decacholine. So what we have to understand, paralyzing dose of succinylcholine initially elicits. What is the meaning of this depolarizing and non-depolarizing? What happens if we want to understand what does it mean? This skeletal muscle relaxants, peripherally acting skeletal muscle relaxants, they are going to work on a receptor which is called the nicotinic receptor. This nicotinic receptor, the, it is like this, which contains sodium in center. It has two alpha units, one beta unit, and one this delta units. This alpha unit contains acetylcholine binding site. As we know, when this, we have seen in the physio also, when this synaptic vesicles which contains acetylcholine, when it is relieved in the synaptic left, it is going to bind with the receptor, and with the binding of the receptor, there will be the pass of this transmission, or the impulse are getting passed. It means the contraction reaction occurs. For this acetylcholine to bind with the synaptic vesicles, we need sodium. This sodium is responsible for this depolarization. So what happens in skeletal muscle relaxants, in the specially non-depolarizing type of skeletal muscle relaxant, this non-depolarizing skeletal muscle relaxant, it is going to bind on this acetylcholine binding sites. It is going to bind on this acetylcholine binding site. It means this D-tubocurarine, it is going to bind here. So the sodium channel will not open. The sodium which was responsible for the depolarization, it will not occur because of the binding of the heavy molecule, heavy D-tubocurarine skeletal muscle relaxants. So this reaction will not occur. The depolarization will not occur. There will be the relaxation. There will be the flaccid paralysis in the muscles. But in case of depolarizing or non-competitive type of skeletal muscle relaxant, what they will do, they are not going to bind on this acetylcholine binding site. What they are going to do, that it is going to open the sodium channel. They are continuously going to be present here. It is going to release the acetylcholine, and because of this release of acetylcholine, there will be the opening of sodium channel initially. Opening of sodium channel will lead to the twitching response, will lead to the, what is twitching? There will be the fasciculation. There will be the little movements of the muscles will be there, which is called fasciculations. But when this continuously presence of this, there will be the continuous presence of this drug to that sodium channel, the sodium channel will get desensitized to it. It means it is not going to again do the opening of the sodium channel. There will be ultimate desensitization of these receptors, which will lead to flaccid paralysis of the muscle. Flaccid paralysis. So for the competitive type of skeletal muscle relaxant, there will be only paralysis. But for the non-competitive, initially there will be the fasciculation, there will be the initial movement, then ultimately there will be the desensitization of the sodium channel and paralysis. So the non-competitive is succinylcholine. Succinylcholine will initially show muscle fasciculation. Then it will lead to flaccid paralysis. So it is for non-competitive but depolarizing skeletal muscle relaxants, succinylcholine. Next question is Verret sign. Verret sign, it is a sign of sedation. When we are going to give a drug, because of the sign, there will be the drooling of this, there will be the drooling of the upper eyelid. And now slowly, when the upper eyelid is going to be drooled, then there will be the time when this lower eyelid will be able to bisect the pupil of the eye. It means there will be the closing of the eye, which is called Worrit signs. It is seen in case of any drug which shows the sedation. The most common drug which shows the Worrit signs shows the closing of the eye, close up, drooling of the upper eyelid and lower eyelid bisects the pupil. That is seen with the parenteral administration of diazepam. Parenteral administration of diazepam. It is the sedation sign. It is the sedation sign. Next question, narcotic overdose can be antagonized. Narcotic overdose. Narcotic means the drugs which are going to have the opioids. Narcotic and the opioids are the same drug. So narcotic drugs can be antagonized by the drug called naloxone. There are three drugs which are used for this purpose: is naloxone, naltrexone, and nalmefene. But the most potent drug which is used in case of overdose, we know whenever there is overdosing of the narcotic or the opioid or the morphine, there will be the depression of the respiratory center. Because of the depression of the respiratory center, there will be the ultimately respiration will be going declining phase, and there will be the loss of respiration and death of the person will occur. So we need antagonist to the opioid receptor, which are going to bind the opioid to the center. Now, the opioid antagonists are naloxone. In case of the overdosing, in case of toxicity, in case of emergency, we have to use this naloxone because it is a drug which is given by the IV. It is the drug which is given by IV route. Naltrexone can be given orally. So it is used when there is a opioid addict and we want him to quit the opioid. So in that case, we can use this drug, which is we can give the person orally so that there is an antagonization of the opioid receptor and slowly person can uh, quit that drug because there will be no longer pleasant feeling by the opioid. But in case of emergency, we want emergency action. Emergency action can occur because of the parenteral administration only. And by the parenteral administration, we mean the IV administration, which we can give naloxone. Next question, which of the following anti-epileptic drug causes irreversible side effects of the gingival hyperplasia? Most of the anti-epileptic drugs shows hyperplasia of gingiva. The most common drug which is used is the phenytoin. Then there can be the drug like carbamazepine. There can be valproate. There can be ethosuximide. These all are anti-epileptic drug. Ethosuximide. But there are some other drugs also like calcium channel blocker, like verapamil, like after the verapamil there is nifedipine, which shows nifedipine, which shows the gingival hyperplasia. But the condition is these all drugs, they show reversible type of gingival hyperplasia. But in our question, the question is what are the drugs which shows the irreversible type? So the irreversible type is not shown by any of them. They show only reversible type of gingival hyperplasia. Less GI bleed is seen in following NSAIDs. As we have seen, NSAIDs, because they are going to inhibit the thromboxane synthase. And thromboxane is responsible for the clotting. If the thromboxane synthase is not there, then bleeding will occur. But it is specifically seen with the non-selective COX inhibitors. COX is the cyclooxygenase enzyme inhibitors. Not preferential also shows some amount of this. Preferential COX-2 inhibitors also shows this. Preferential means we have seen this COX enzyme, it is 1, and COX enzyme 2. This COX enzyme 1, it is present in normal physiological conditions, but this COX-2, it is present in the pathological conditions only. So in the pathological condition, COX-2 is present, and this COX-2, if it is preferentially, it means 90% the drugs are going to block the COX-2, but 10% it is going to block COX-1 as well. So it also shows thromboxane synthase inhibition, but the selective COX-2, selective COX-2 does not show. Selective COX-2 is celecoxib, reficoxib, etoricoxib. So the answer is selective COX-2 inhibitors. Aspirin is involved in the children with influenza infection because of the association. One of the important drawback of aspirin is that when it is given to the children who has recently recovering from the any viral infections, like the chicken pox viral infection, if they are recovering and we are going to give aspirin to those person, then this aspirin, because viral infections like chicken pox, it is going to affect the liver. And when this aspirin is given to those persons, then there is excessive hepatic damage. Because of that, there will be the increase in the serum transaminase. So it should be avoided in those children who are recently recovering from the viral infections. So we should not give them to them. We should not give to those person who are having the hepatic diseases. So we can like hepatitis. We should not give to that person. Aspirin should not be given. All of the following statements about pain are correct except analgesia is associated with the mu and kappa receptor. What is mu and kappa? These are the opioid, meaning analgesics are opioids. This opioids work through the opioid receptors. These receptors are mu, kappa, and delta. Mostly the drugs which are opioids, which are we are going to use like morphine, they are mu receptor agonists. But there are some complex opioids also which are going to have the agonistic, antagonistic, means it is going to have the agonistic effect on mu. It can have the antagonistic effect on the kappa as well. So they have the complex opioids. So analgesia is associated with the mu and the kappa receptors. Yes, it is right. Dysphoria is associated with the S receptor. Dysphoria means when the person is unhappy, sad, the feeling of sadness. So yes, it is associated with the S receptors. Third, NSAIDs benefit by preventing the prostaglandin synthesis. Yes, aspirin, we have seen in the earlier question also, aspirin is going to have the effect on the prostaglandin. Prostaglandin synthesis is inhibited because the COX enzyme COX enzymes are inhibited, so prostaglandin synthesis are inhibited. Yes, it is also correct. Naloxone is a non-competitive antagonist and irreversibly opposes the opioid. No, it is a competitive antagonist. Naloxone, which is a antagonist to the opioid receptor, it is a competitive type. So the option 4 is incorrect. Which of the following opioids are not given intrathecally? Intrathecally, which opioids cannot be given? Morphine can be given intrathecally, as you have seen some morphine addicts used to give the morphine shots by intrathecal examination. Sufentanil, yes, it is also given intrathecally. Fentanyl, yes, it is also given, but the ramifentanil, there are not much animal or the human studies are there regarding the intrathecal use of the remifentanil. Whatever the studies are available on the animals, it shows intrathecally they do not provide the benefits. So the remifentanil, it is not given by the intrathecal route. Clotting time is the most likely to be prolonged by the administration of clotting time. Clotting time prolonged. As we know, vitamin K is responsible for the clotting factor synthesis. Yes, it is required for the clotting factor. Yes. Clotting time is prolonged by this. No, it is not prolonged. It is required. It is reduced by this. Barbiturates. Barbiturates like phenobarbital, it does not have any effects on the clotting time, so it is not there. Acetaminophen, that is other name for paracetamol. Acetaminophen, no, it does not have any action on the clotting factor. Acetyl salicylic acids like aspirin. Aspirin is going to inhibit the thromboxane synthase inhibition. So yes, they are going to decrease the clotting time. Drug which is used to control the status epilepticus, we have already seen benzodiazepines, lorazepam, then diazepam. It is required. It is a continuous attack of epilepsy within 30 minutes. 2 or more attacks are seen. IV ultra short acting barbiturates. Ultra short acting barbiturate is only thiopenton sodium. Why it is ultra short acting? Because it terminates its action by redistribution. It is one of the important questions. Redistribution. What is redistribution? Redistribution means redistribution means uh, it has a tendency of the high lipid soluble drug that it is taken by the high flow organ first. High blood flow organ take this drug. Like high blood flow, like brain, like heart, they will take the drug. And after they have used all the drugs, they are going to give this to the lesser blood supply organs. Because they are powerful, they have taken the drug, and then they will give the throwaway. They will actually throw away the drug to the less vascular organ. So less vascular organ will accept only smaller amount of the drug. Because of this high lipid soluble or high vascular organ take this drug, because of this redistribution of the drug, this drug terminate their action. The most common drug which terminate their action by redistribution is the thiopenton sodium, which is ultra short acting barbiturates. And one more thing about this barbiturates. Barbiturates are the drugs which are invented for the sedative and hypnotic purpose. These are the first drug which was invented for the CNS purpose, but it has seen they are having multiple adverse effects. Multiple adverse effects like they are potent enzyme inducer. Because of that, there is very much drug interactions. Second, they are respiratory depressors. So they are going to depress the respiratory center. That's why it is very harmful to take. Then it is going to, if it is taken for the sleep, it is going to disrupt the sleep architecture. So that's why it is very problematic for the person. To overcome this disadvantages, benzodiazepines are invented. But nowadays also this barbiturates are used, but the use of the barbiturates are very limited because of this adverse effects. There are only two major uses are there. First is this thiopenton, which is a barbiturate that is used in general anesthesia. Second use of barbiturates, phenobarbital, which is used in case of only in the epilepsy. So only two uses of barbiturates are seen. First, it is used in the general anesthesia. It is used, and as an epileptic, phenobarbital is used. These are the two uses of barbiturates. Intramuscular administration of 0.6 milligram of atropine. First, we have to collect what is atropine. It is anticholinergic drugs. Anticholinergic means it is going to have the effect on the M receptor. It is going to antagonize the M2 receptors. M1 receptors, they are present on the gastric gland. Second, M2 receptor, they are present on the heart and heart, they are present, and 3 receptor, they are present on the other cells. So this atropine, these are M receptor antagonists. When it is given in a 0.6 milligram to a 50 kg adult patient, produce all of the following effects except we know aspirin, the atropine, it is a Drug which is responsible for tachycardia. The first effect which is seen by tropin is the tachycardia. Then it is going to decrease all the secretions. Secretions are decreased. So decreased salivation will be seen by this, sweating will be seen by this. Then it is going to have the effect like mydriasis, because cholinergic drug produces meiosis, constriction of the pupil. This anticholinergic drugs, it is going to do the relaxation of the pupil because of the no contraction to the ciliary muscles. There will be the dilator muscles are relaxed. So the effects which are not produced is the bradycardia because they produce tachycardia. So answer is 1. Phenothiazines. What is phenothiazines? Phenothiazines are antipsychotic drugs. These drugs are used to reduce the psychotic symptoms. Antipsychotic drugs are divided into two types, typical and atypical. Typical antipsychotic drugs like chlorpromazine, haloperidol, then the most commonly levosupride, which are used. And atypical, which does not have much adverse effects like the typical one. Phenothiazine is one of the category of the typical antipsychotic drugs. So it is used for what purpose? For relieving the psychotic behavior. So it is used for the altering the psychotic behavior. One of the benzodiazepine comparatively safe in pregnancy. Safe in pregnancy is lorazepam. That's why if the female is pregnant and has status epilepticus attack, then we can give this lorazepam to that female because it is safer in the pregnancy. An attack of migraine can be terminated by migraine. For the migraine, we have uh, multiple type of drugs. First is NSAIDs, which are given. If it is along with the nausea and the vomiting, then we give antiemetics for that. For the termination of attack, the most common and most first choice of the drugs are ergotamine, ergot alkaloids, and newer drug which is formed for this are triptan. Triptan. Triptans can be given. Other category, they are used for the treatment, for termination of the attack. But for the prophylaxis, for prevention of attack, we give multiple drugs for this like beta blocker, propranolol can be given. Some of the newer anti-epileptic drugs can be used for this purpose. Very important question. Newer anti-epileptic drugs which are used for the termination of attack of migraine for prophylaxis is the topiramate. Topiramate. Then zonisamide. It can be used for this. Zonisamide and topiramate and valproate. It can be used for the prophylaxis of the migraine attack. Beta blocker, anti-epileptics like topiramate can be used. Sorry, zonisamide cannot be used. Valproate can be used for the termination of attack. Next question, all of the following decreases the skeletal muscle tone by CNS. We have earlier seen that skeletal muscle relaxants are two types, peripherally and centrally. Centrally, which are going to act through the CNS or the cerebrospinal axis. The drugs which are used for this are called centrally acting skeletal muscle relaxants like benzodiazepines, baclofen, mefenacin cogeners like chlorzoxacin. Chlorzoxazone, which is most commonly used for this purpose. Defibrillary is also a skeletal muscle relaxant, but it does not act through the CNS. It is peripherally acting skeletal muscle relaxant. Next question. Morphine is a powerful opioid analgesic drug, should be avoided in all of the following conditions. Morphine. Morphine, what is morphine? It is opioid drug. So opioid drug, because it is opioid, it leads to the respiratory depression. Yes. One of the disadvantages. Opioid addicts are severely constipated, yes. Opioid leads to increased intracranial pressure, yes. Opioids are going to, if the unknown reason of abdominal pain, it is going to increase that pain because it is going to increase the intrabiliary pressure also. So yes, so we should not give to the any condition like bronchial asthma because it creates bronchospasm, constipation. It already causes constipation. We cannot give for the treatment of this. Pancreatitis, it is one of the abdominal pain conditions, so we cannot give because it is going to increase the intrabiliary pressure also. So we can give in case of left ventricular failure. We can give this drug. Okay. Carbimazepine. What is carbimazepine? Carbimazepine is an anti-epileptic drug, but apart from anti-epilepsy, we can use this drug in other conditions also. Like in case of depression, we can use this. In case of, it is drug of choice for trigeminal neuralgia, we can use this drug. Apart from that, we can use this drug in case of panic disorders. We can use this drug in case of mania. We can use this drug in case of bipolar disorders. So these are the uses of carbamazepine. So it is used as an antidepressant, anti-inflammatory, no, antibiotic, no, antiemetic, no. Phenytoin. Phenytoin, the most important question about the phenytoin, its mechanism of action. How does it work? It works through the sodium gated channel inhibition, like the local anesthesia. It also do this so that the electrical firing which is occurring in the brain, it stops because sodium is responsible for the conduction of the impulses. So the electrical firing can be stopped by reducing the conduction of the impulses, which can be done by the inactivation of the sodium channel. Inactivation of sodium gated channel. Okay. Second, the most important question about the phenytoin is the side effects of the phenytoin. We can remember the side effects of the phenytoin by HHH. What is it? First H, which is produced by the phenytoin, is the hyperplasia of gums. Hyperplasia, hypertrophy of the gums can be seen with this. Second, it produces hirsutism. Hirsutism is formation of hair in at the ear pinna region, especially in the males. Uh, Next H, it hypersensitivity reactions with this, and most important, if it is taken by the pregnant female, it can cause fetal hydantoin syndrome. It means there will be the cleft lip in the offspring if mother has taken this phenytoin. Apart from this, it produces osteomalacia and it produces megaloblastic anemia. What is megaloblastic anemia? Deficiency of folic acid. Because of the deficiency of folic acid. So, phenytoin is associated with this. A 50-year-old female with the end-stage renal diseases developed the pulmonary tuberculosis, one of the drug which should be used in reduced dose. Very important question to understand. Tuberculosis, the drug which is used for the tuberculosis is the rifampicin, isoniazid, paracetamol, ethambutol. Every drug is used for this. But if the female is having end-stage renal disease, then which drug should be used in reduced dose? Then the ethambutol is the drug which should be used in the reduced dose. If the person is having end stage renal disease or the pulmonary tuberculosis with the end stage, because this drug is going to have the metabolism in the renal area. So this ethambutol should be given in a lesser dose if a person develops tuberculosis along with a renal disease. Which one of the drug causes extrapyramidal symptoms? Antipsychotic drug produces two types of symptoms. Antipsychotic drugs. There are two types of symptoms. First is the pyramidal symptoms. Second is the extrapyramidal. Pyramidal symptoms like the symptoms confusion, behavioral abnormality, ataxia, there will be restlessness, there will be the postural hypotension. These are produced by this. Then there is extrapyramidal symptoms. Extrapyramidal symptoms because it is going to decrease the dopamine. When this dopamine is reduced, it produces the symptoms of Parkinson's. Parkinson's symptoms are rigidity, tremor, hypokinesia, especially in the facial areas. There will be the facial tics. There will be the dystonia, muscular dystonia, because of the side effect of the extrapyramidal symptoms. It is usually seen with the antipsychotic. One of the antipsychotic is phenothiazine, like chlorpromazine. So it is seen with these drugs. One of the obvious consequences of the ethanol ingestion in the many individual is facial flushing and increased heart rate triggered off by getting alcohol metabolized too. What we have to understand, how this alcohol is metabolized in our body. If alcohol can be of two types, which can be ingested, ethyl alcohol or methyl alcohol. Antiseptics which contains this ethyl alcohol or ethanol, antiseptics contains this methanol, the methanol. So for the metabolism of ethyl and methyl alcohol, we need alcohol dehydrogenase enzyme. When this enzyme is there, it is going to metabolize ethyl alcohol in acetaldehyde and methyl alcohol in formaldehyde. When this aldehyde dehydrogenase enzyme is available, aldehyde dehydrogenase enzyme is available, acetaldehyde will form acetic acid and formaldehyde will form formic acid. So the question is, how it is triggered off? By the acetaldehyde into the acetic acid. Acute barbiturate poisoning. We have seen barbiturate, the major side effect is the respiratory depression. So there will be the respiratory failure in the person. Ethyl alcohol is more effective than when mixed with the water as used. When the concentration of the alcohol is up to 60 to 70%, at this concentration, they are highly effective. Whether it is antiseptic or it is a disinfectant, it is highly effective. When the concentration is between 70 to 90%, the effect is constant. Above 90%, their effectiveness decreases. So more effective when mixed with the 60 to 70%, mixed with the water and used as. Next question. In rate of injection of intravenous Valium. What is Valium? It is diazepam. So it is given in the 1 ml per minute. It is given. Next question. Buprenorphine. What is buprenorphine? It is complex opioid. Why it is complex opioid? Because morphine, it is a simple opioid. It is going to have the agonistic action on the mu receptors only. But this complex opioid, it has the agonistic antagonistic action. Means it is going to have partial agonistic action on mu receptor and antagonistic action on the kappa receptors. So buprenorphine, it is the mu receptor partial agonist. Partial agonist means when the efficacy is when it is going to have the action not that much as the agonist has. If the agonist is going to have the action 1, this partial agonist is going to have the action below 1, but more than 0. Because if action is 0, then it means it is antagonist. It is going to block the action of agonist. And inverse agonist, when the action is -1, because it is going to inverse the action of agonist. All are the symptoms of opioid withdrawals, except, as we know, opioid, what are the symptoms? They produces constipation in the person. They produces dryness of the eye, dryness seen, and the special feature which is seen with the opioid addict is the meiosis. So when the withdrawal is there, then this meiosis will convert into the mydriasis. There will be the there will be the dryness will be lacrimation, constipation will cause the diarrhea, but there is no action on the speech. So excessive speech is not seen. One of the following muscle relaxant has the maximum duration of action. Their peripherally acting skeletal muscle relaxant can be of 3 types: long acting, intermediate acting, and and there is short acting. The example of short acting is the mevacurium. It is also one of the important. What are the short acting? Short acting competitive. Short acting competitive. Peripherally acting skeletal muscle relaxant. It is mevacurium. Long acting is D-tubocurarine, doxacurium, ancurium, epicurium. Intermediate is atracurium, cisatracurium, vicuronium, rapacuronium, and rocuronium. These are the examples. How the maximum duration, which has the longer duration of action. That's why we have divided into the 3 classes. A hemophilic patient, hemophilic, which is bleeding disorder, has rheumatoid arthritis, so means we have to give the NSAIDs are prescribed to relieve the pain. So which drug we can give? Because non-selective COX inhibitor are going to increase the bleeding. Already patient is hemophilic. If we are going to give non-selective COX inhibitor, it is also going to increase the bleeding. The person will have the excessive bleeding, like acetylsalicylic acid, naproxen, phenylbutazone. Acetaminophen is the paracetamol. Why we can give? Because it is analgesic and antipyretic, but poor anti-inflammatory. We can give to the person who is hemophilic. All of the following is true about parasympathetic nervous system. Parasympathetic nervous system, we have seen in our earlier lecture that these are the nervous system which contains preganglionic fibers. All the sympathetic and parasympathetic, they contains fibers. If the fibers are before the ganglia, it is preganglionic. If it is after the ganglia, it is postganglionic. So parasympathetic nervous system, it releases acetylcholine in preganglionic fibers as well as in the postganglionic fibers. But for the sympathetic nervous system, it releases acetylcholine as a neurotransmitter in the preganglionic region. But in case of postganglionic sympathetic, it will release noradrenaline. So, acetylcholine is a transmitter at preganglionic and postganglionic junction for parasympathetic nervous system. For sympathetic, there is norad at the postganglionic junction. So noradrenaline neurotransmitter at postganglionic junction, it is for sympathetic, not for parasympathetic. The last question which we are going to take in this session is the all of the following may be sedative and hypnotic. Sedative and hypnotics, these are the drugs which produce sedation and hypnosis. The function of sedation and hypnosis, it depends upon the concentration of the drug. If we are going to take the drug in a larger concentration, it will produce the hypnosis. First, the effect is sedation when it is taken in a lower dose. When it is taken in a higher dose, there will be hypnosis. If it is taken in a more dose, then there will be unconsciousness. So because of that, anesthetic effect will be seen. And if this again it is taken in a higher dose, coma and death of the person can occur. Zolpidem is the sedative hypnotics are also divided into three. First is barbiturate, which is no longer used for this purpose because of its disadvantages, which we have already discussed. Benzodiazepine, which are most commonly preferred drug, but they are also having the side effects like the sedation all day, or there will be the short-term effects can be there with this. So there is a new drugs which is non-benzodiazepine, which does not react on the benzodiazepine receptor like zolpidem, which is used for this purpose. Last question which we are going to take is the benzodiazepine antagonist. Till now we have seen the drugs which are benzodiazepines, agonists like lorazepam, alprazolam, clonazepam, diazepam, because they are going to have the agonistic action on the benzodiazepine receptors. The drugs which are used for in case of these drugs toxicity, which are going to antagonize the benzodiazepine receptors, which are going to have antagonized, are the benzodiazepine antagonist flumazenil. Only example of this is the flumazenil, which is used to antagonize the benzodiazepine receptors. So this was about CNS, GA, LA, and NSAIDs. I have tried to cover as much concepts as I can. So it will help you in solving other MCQs because we have discussed the concepts in a very good manner, in a brief manner we have discussed. So that will help you in the other sessions also, other questions also. Thank you so much.